So we conducted this STEMI registry to investigate how ESC guidelines are followed in clinical practice. So we performed this registry in about 27 European countries and looked for patients with ST elevation myocardial infarction who were admitted to hospital within 24 hours after symptom onset. And we were able to include 11,000 patients in this registry. So, as I have said, 11,000 patients with STEMI were included in this registry. About 3/4 of these patients were treated with primary PCI, which is a preferred revascularization therapy in the ESC guidelines. So guidelines are followed in almost 3/4 of the patient. And these patients treated with primary PCI, they had a quite low in-hospital mortality of around 4%. On the other hand, we have believed that once you are treated with primary PCI, nothing will happen within the next year. This is unfortunately not the case. So another 4% of this patient will die within the next 12 months. So what we have seen is if you follow guidelines with respect to reperfusion therapy, with respect to secondary prevention measures, that means dual antiplatelet therapy, statins, ACE inhibitors and beta blockers, your outcome will be quite good. But there are still patients not receiving, for example, dual antiplatelet therapy, not receiving ACE inhibitors, not receiving ICDs after MI with a large infarct, and these patients still have a high mortality, so we are still not there with our secondary prevention measures. I think the thing is to concentrate on risk stratification. We should be able to identify patients with a higher risk at follow-up very early and treat these patients very intensive with our secondary prevention measures. So there are patients who will have a good outcome, but there are still patients with a high risk, and it's necessary to identify them early and to treat them intensively.